But in true Elon Musk fashion, his radical pursuit of innovation might stand the best chance of coming out on top. Synchron is another US-based BCI startup company that has already completed their first round of human trials in 2023, implanting 10 patients with their own neuron-sensing electrodes. This company is important to watch because it is currently being funded by Jeff Bezos and Bill Gates, two wealthy and powerful individuals who do not seem to like Elon Musk very much. The method used by Synchron to access the brain is considerably less invasive than the procedure being done at Neuralink, which is a big factor in allowing human trials at Synchron to move at a faster pace. Instead of approaching the brain through the skull, Synchron uses a stent-based procedure that they call a stentrode. A stent is basically just a wire that is inserted into a blood vessel, which is just a large vein. They're like the highways of the circulatory system. Typically, doctors will use a stent to free up a blockage inside the vessel that might cause a heart attack or stroke. In the case of the stentrode, the device is using a primary blood vessel as an express lane directly from the chest into the cerebral cortex. Once the stentrode arrives in the brain to an area directly below the motor cortex, an expandable mesh is deployed that interfaces with the walls of the vessel. And this mesh contains 16 electrode sensors that can begin detecting and transmitting neural activity back down through the wire and into a device that is attached to the patient's chest. So how does that compare to Neuralink? Well, let's go back to what we were just talking about at the beginning. The first Neuralink patient has had 64 tiny wires inserted into the surface of their brain by an ultra-precise surgical robot, and each wire contains 16 electrodes just in the microscopic tip that goes around 2 millimeters deep into the brain tissue. That is a total of 1,024 individual electrodes that are distributed across the circular hole that's been cut into the patient's skull. And then, looking at our stentrode again, we have 16 electrodes placed inside a blood vessel that is adjacent to the brain material we want to monitor. Even with this significant disadvantage on paper, in practice, the Synchron BCI is currently able to achieve the exact same function that Neuralink is